Hi, this paper outlines the rationale and describes the research protocol of a multi-university, cross-jurisdictional, longitudinal prospective tracking study that seeks to better understand the factors that influence where allied health and nursing graduates choose to work. The research team has recently expanded from the 3 universities mentioned in the article, Monash University, the University of Newcastle, and Deakin University, to include the University of Queensland and University of Southern Queensland through the involvement of Southern Queensland Rural Health and the University of South Australia. Consideration of 4 issues drove the initial thinking about the study. Firstly, in the main, systematic long-term health workforce research in Australia has focused on medicine. Secondly, the Rural Health Multidisciplinary Program requires universities to establish approaches to allied health and nursing graduate tracking like those of medicine. Thirdly, the World Health Organization's advocacy for systematic approaches to health workforce tracking that make use of routinely collected data. And finally, the benefits of structuring the study in a manner that allowed multiple layers of comparative analyses. For example, comparing outcome of a student's placement location on their choice of practice location. Following an initial conversation at the 2017 National Rural Health Conference, researchers from Monash Rural Health and the University of Newcastle Department of Rural Health started work on the study in May 2017. The study aims to better understand why nursing, midwifery and allied health graduates choose to work in metropolitan or regional, rural or remote settings through exploring factors that influence a practitioner's decision about where they work. As described in the article, we are seeking to achieve this through a longitudinal prospective study design that tracks whole cohorts of university graduates for 10 years following graduation. The study links routinely collected university student information with registration and practice location information available from AHPRA and student and graduate information collected through surveys. Our published preliminary findings have provided both initial proof of concept while also identifying an association between a student's rural background and increased odds of undertaking clinical placements and clinical placements in a rural setting and rural practice in the 2 years following graduation. We think that into the future, findings will be used to inform workforce planning and strategy, particularly in non-metropolitan settings, and ultimately that this will support better health service planning and outcomes for non-metropolitan communities. We welcome you to contact us if you're interested, as per the details on the article.